You're listening to the Ethos Athletes Podcast, where we believe that your health is the number one resource you need to accomplish your dreams. My name is Dr. Matthew Hernandez, and I'm a physician dedicated to helping my patients maintain their active lifestyle and continue doing what they love. I'm sitting down with other experts so that we can provide our listeners with the knowledge they need to improve their health and live their best life. Hey everyone, this is Dr. Matt with the Ethos Athletes Podcast, and today I want to talk to you about the benefits of sports massage. And so for this particular episode, I brought in my good friend and special guest, Don Wong, who is a sports massage therapist. He's located just a few miles from my clinic on Tatum and Shea. Don, welcome to the show.
Thanks, Dr. Matt. Thanks for having me.
So let's start off with what got you into becoming a massage therapist, and more specifically, a sports massage therapist?
So what got me into it was I actually had an injury. I had injured my shoulder. It actually happened outside of CrossFit, but it impacted my CrossFit workouts. And my shoulder, I actually couldn't raise my left hand above shoulder height. I had a sharp pain. It was actually in the AC joint. And at that time, I had just started CrossFit a little bit less than a year prior to that. And I got into CrossFit for my health because I was pre-diabetic prior to doing CrossFit. I had a desk job. And I reversed all of that naturally through CrossFit and nutrition. So in my mind, I had to do burpees or I was going to shoot insulin. So I was like, I have to get this shoulder taken care of. And I was aggressive about my getting therapy. And I met a lot of therapists who, quite frankly, just had no idea what they were doing. And then I met a very small handful of healthcare providers who really knew what they were doing. And I was actually able to heal up my shoulder without surgery and was able to come back to working out, and I've been pain-free ever since. Yeah. So when I decided to leave corporate America and go into work for myself, I said, hey, I want to do that. I really want to help people rehab from injuries, because there definitely is a big need for that, and not too many people out there who really, get into all the specifics of how to help rehab somebody from injury.
That's a great story. Now you're very well known in the CrossFit community and the triathlete community as well, right? Mm-hmm. The number of I know that's the majority of the population that you see. You treat a lot of CrossFit athletes and a lot of Ironman, as to my knowledge at least. What's the difference between someone getting a sports massage and a relaxation massage?
Yeah, good question. So for sports massage specifically, I'm looking at identifying areas of restriction or pain or loss of range of motion, particularly as it relates to performance. So, and that's why I think it's really good to understand the sport that you're working on. So, for example, I tell people, it's like, hey, if you're looking for a good golf massage therapist or body worker, or a good, like basketball or baseball, I'm not your guy, because I can work on your body, but I don't understand all the intricacies of all those sports. Whereas like in CrossFit and run, bike, swim, and even actually roller derby too, I've study the sport and participate in the sport and have a much more personal understanding of how the body moves and how pain and dysfunction affects that. So in the sports massage, again, we're looking to break up scar tissue, free up range of motion, get you moving and functioning better. And quite frankly, a lot of times it's just not comfortable. A relaxation massage, you can imagine yourself being there for an hour with, some hot stones and some, essential oils and a nice waterfall in the background. that's just not me. Most people end up cursing at me on the table. Sometimes they throw some punches. But again, it's therapy. It's to get you moving and performing better. I tell my clients, like, hey, I'm not here to make you feel good. I'm here to help you feel better.
Yeah, no, I think that's a great distinction to make. Now, if you have someone that is coming in for pain of some sort, how is your approach slightly different than, or how is your approach different than a relaxation massage? Like you kind of look at a little bit more of the biomechanic and some of the things that are connected that are maybe causing that pain, right?
For sure, yeah. So, again, understanding the sport that you do and how you move your body gives me a clue as to understanding what types of compensations could happen. And then where the true causes of the pain could be. So, for example, in CrossFit, we have people who have low back pain or mid back pain, particularly after they press overhead, especially like in high rep push press. Mm-hmm. So, if you went into a run-of-the-mill massage place or a relaxation place, they might say, okay, let me go and, put hot stones or, put pressure, let me massage your back and alleviate that pain. And it might feel better, but the next time you go to work out and you go back to those high rep push presses, you're hurting again. Well, one of the things that I'm going to think about is like, okay, well, I know you need to go into an overhead position. So let's check out your external range of motion, external rotation in your shoulders to see if there's a compensation. And there's a lot of times when people can't properly externally rotate their shoulders and can't get their hands properly in a vertical position, head through the window. So then they compensate by pushing their hips forward and overarching their low back. So that's actually where the pain is coming from. It's not from a deficiency in the low back. It's coming from a deficiency in the shoulders for that particular movement. So yes, we want to work on the low back to alleviate the pain, but ultimately what I'm going to work on is getting that range of motion in the shoulders so that you're not compensating in the low back. I kind of tell people, it's like you have to look at the true cause of why the pain is happening. Kind of like if you have a car and there's smoke coming out of the tailpipe, is the problem in your tailpipe? Could also be coming from your engine and just exiting your car from the tailpipe. So you want to have someone who understands how you move and where you could be compensating as a true cause of that pain.
Okay. Yeah. Now, are most people coming to you because they're injured, or are they coming to you for prevention, or a little bit of both? Or
most people, when they first come to see me, they come to see me because they are injured. Okay. Because quite frankly, we don't really think about injury and mobility and movement assessment unless we have a problem. Mm-hmm. There maybe one day people will get up in the morning and reach down and try to touch the toes, and they'll be like, oh, well, I'm a couple of inches deficient. I should go and, get some therapy on it. It's like people typically wait until, oh my gosh, my back hurts. I need to figure something to do about this. But once we get people in and, get them feeling better, I'm always going to put people on some sort of recommendation for good self-care. My belief is that if you can do good self-care, you can get about 80% of your issues managed on your own. And that last 20%, you just got to find somebody with some steel fingers to break up the rest. And that's typically when people come to see me.
Yeah, that makes perfect sense. Well, what are some of the things that you are typically treating? You mentioned mid to low back pain. What are some other things that you see?
Yeah, so a lot of times people come to see me for shoulder issues, low back and hip issues, and often knee pain as well. I mean, people have, the aches and pains. My desk sitters are going to have that neck and shoulder pain and the low back pain, all the pains related to long-term sitting. But again, with the populations that I specialize in, the CrossFit, triathlete, and the Derby, those are the major joints that take the brunt of all that exertion, and those are the ones that typically, when they give out, they impact on people's performance, they impact on people's ability to sleep. So then that prompts somebody to go and seek care.
Okay. When someone has hit a pain point where they're literally in pain or they have some sort of injury, would you say that the first person that they typically seek is a massage therapist, or do they usually go somewhere?
So it kind of depends on how people hear about me. If it's like from a friend or someone they work out with, they'll probably get that recommendation and say, oh yeah, go see Don. I had the same thing. He'll work on you. So that's one population, and the other population are people who've actually gone through the traditional medical route, right? Like they have a shoulder pain, so they don't know what to do. They go and they see their primary care doc. Primary care doc then says, well, you should go see an ortho. And then they go see an ortho who orders an MRI, and then the MRI comes back clean. So they said, well, maybe you have to go and just take these muscle relaxers or, go find a PT or something like that. And it's typically, by the time they've gone through that, they've been living in pain for several months and they haven't had any relief. And we've already ruled out that it's not structural. So, there's a good chance that it's just muscular in nature. And then that way they kind of just find me by asking around. So it's kind of really one of those two paths. Yeah.
Now, I want to kind of explore a little bit about what the part that you just said. So we know that obviously if it's a muscular problem, if there's some sort of like minor biomechanic problem, you're able to correct that. When is something too much for you to it's outside of you being able to fix it?
Yeah, definitely if there's a structural issue, right? So sometimes if someone comes in and they complain about shoulder pain and we just do some simple tests and we figure out, oh, well, you probably have a supraspinatus tear or you have a labrum tear, and that's when I would refer out.
Okay.
The other thing too is, again, I'm going to work on cleaning up that pain and that scar tissue, but why did that even happen in the first place? So if someone has a movement deficiency or if someone has a severe muscle imbalance, then I can work on getting them out of pain and getting that range of motion back, but then their follow-up is they got to go see a good PT. They got to find somebody who can identify those weaker muscles, give them proper exercises to strengthen them, so they correct the underlying problem and stay out of pain. And same thing if they have a muscle tear or a tendon tear, then they become a good candidate for a PRP, so that actually heals it up. So it just kind of depends on the overall assessment of what the person's going through and how they respond.
Okay.
Yeah, but I'm always looking at, who else needs to be part of this team.
Right.
It's definitely a team approach to helping people get better and stay better.
Now, how much do you see, you just said a second ago that muscle imbalance is kind of your wheelhouse. That's essentially what you're treating, correct?
I wouldn't say imbalances so much as more like scar tissue.
Scar tissue, okay.
Yeah, restrictions. I just don't have the training and stuff to properly test for true muscle imbalances.
Okay.
Like TFL versus glute med or stuff like that. I mean, those are better left to a properly trained physical therapist or someone who has that skill set.
Okay.
Yeah.
No, that's perfect. So when someone comes to you, and let's say they're coming to you and they're in pain, and obviously everyone's going to be a little bit different, what kind of results can they expect from a given treatment, and how long do these results typically last, or how frequent do they have to come and see you?
Yeah, it all depends on the severity of the situation. It all depends on how long it's been going on. Ideally, if someone has a fresh injury, like say, They were deadlifting and they pulled something in their low back. Ideally, I would be seeing them somewhere between 24 to 72 hours of the initial event.
Okay.
That would be ideal because within that first 72 hours, that's when the body goes through its natural inflammation phase, and a bunch of collagen gets laid down to help stabilize all the tissues. So that all that collagen needs to get remodeled and reshaped so that it goes in the line of pull of those muscles, rather than laying down in a random position, and that random position causes all that restriction. So I kind of tell people, it's like, this is that first 72 hours, you've got wet clay, and we got to mold that wet clay before it hardens up, and then it becomes a lot more difficult. And I tell people, after the first 24 hours is typically a little bit better, because the initial 24 hours, you get massive inflammation, and sometimes it's just too sensitive to work on. But so that's like in a case of an acute injury. But if someone has some stuff that's been nagging for a long time, it could take several sessions before they actually start getting some long-term relief. Typically, the first session it's uncomfortable. It's going to be intense, because these tissues haven't been moving. It's like an old Band-Aid that's been on there for a long time, and now you got to rip it off, and it's just not going to feel good.
Yeah.
But it's just like working out. The first time you work out after taking a long break, it doesn't feel good. You're sore. So ideally, what I would like to see people do is be on a daily routine of self-care. I tell people 5 minutes a day, every day. Do something for 5 minutes a day, every day, that works on your problem area. A lot of times people, they get told, well, I have to stretch, I have to do this for 30 minutes every day. And it's like, yeah, in an ideal world, great, but we have busy lives, we have stuff to do. You'll do that for like 3 days.
Yeah.
And then you'll fall off.
Yeah.
But everyone's got 5 minutes that they can find. If you split it up between right and left sides, 2.5 minutes each side. And, I tell people it's that consistency that's key, because if you have, for example, back to our working out analogies, if you have a personal trainer who you see once a month and you get this best kick-ass workout from them, and it's great, but you don't see them again for another month. Compare that to doing 10 push-ups, 10 sit-ups, 10 squats a day, every day for 30 days. Which one's going to give you the better long-term results, right? The consistency.
Yeah, so, I love that analogy.
Yeah, so ideally, I'd like to see people get onto maintenance, where I see them once every 4 to 6 weeks. That being said, they're doing their daily self-care and taking care of that 80% on their own. Of course, in the beginning, sometimes we have to go more intense. I might need to see people once a week for a few weeks until we get over the hump, and then gradually pull back. But when I had my injuries and all that type of stuff, I didn't have the time or resources to be seeing people all the time. So I do my best to get people feeling better and get them onto maintenance as fast as they can.
Okay. Is it safe to say that individuals who are going to you more for preventative problems, is it truly preventative? Do you see the same amount of injury in that population than you do in the people that come to you, and they're injured? And
yeah, definitely people who are consistent with their care and come in on a preventive basis, they have less injuries, they perform better. It's just routine maintenance.
Mm-hmm.
Back to our car analogy, the harder you drive your car, the more frequently you got to change your engine oil. The more frequently you got to rotate your tires. The more that you're pushing your body and come in on that routine basis, come in for that regular oil change, then you're going to get more life and more performance versus waiting for something to break.
Yeah.
You can go 20,000 miles and never change your oil, and then when you actually have to do it, you got to replace the whole engine because everything melted down in there. So it's great when people are on a training schedule. So for example, a lot of my triathletes, they're training. They have a 4-month, 6-month, sometimes 8-month training schedule as they build up to their big race. And then we just schedule it, and we know when they're going to have increases in volume. So we schedule, in anticipation of that, to keep them up and running so that they can continue to perform.
Okay. If someone is looking to get, we talked about the benefits of massage therapy or sports massage therapy. It does prevent injury, and so even if you're not injured, good idea to get it just so you don't have an injury down the road. What should our listeners look for when it comes to selecting someone who is good at sports massage?
Well, again, someone who understands their sport.
Yeah.
Definitely, you want someone who knows how you're moving your body and where the common failure points are. What are the things most likely to break down, and where are you most likely to compensate? So definitely that's important. I also believe it's important to find somebody who has multiple modalities. Can they also rock tape? Can they also stretch? Can they also do some cupping? Something else, because it just takes a lot of different modalities to really get the body to restart its innate healing processes when you've been stuck in that pain cycle for a long time. And from my perspective, someone who can apply some pressure, because if when you got scar tissue and you got all that stuff that's locking you down, it to me, like, the analogy I like to give is, it's kind of like, you have that person who's trapped behind a locked door, and you got to break that locked door down to free them. You just can't throw tennis balls at that door. You got to use a little bit of, sledgehammer, and you got to knock it down to set that person free.
Yeah, and Don is very well known for being able to do that. I've talked to a number of his patients, and they all absolutely love him, and everyone says that it's like the pain room when they walk in. Now, that being said, if you can, he does lay back a little bit if you need it as well.
Yeah.
Because I've received massage from him, and there's times I had to say, hey, I just back off just a little bit. Yeah. But at the end of the day, you do end up feeling a lot better once you're done with it. So
yeah, I tell people it's like a good workout.
Yeah.
I want it to be intense, but I don't want it to be painful, because intensity brings results. So the more intense I can apply the pressure, the quicker the results will get. It's kind of like a good, if you have this experience, it's like when you have a great workout, it's like you almost want to throw up. If I actually make you throw up, then I went too far. So.
Yeah, for sure. And then just the final thing, Don, what do you call it? What tips do you have that our listeners can go and start applying to their life to help them prevent injury, various things like that?
Yeah, again, look for that daily self-care routine. And I definitely would invest in a few basic products. So I would invest in a lacrosse ball, and I would invest in, I don't like the rolling sticks so much as just a straight piece of 1/2-inch PVC pipe that actually doesn't roll. I think those two little pieces of equipment, and they'll probably run you less than $5 total if you get that. Those are like my two go-to devices. Because if I have a knot in my back or a knot in behind my shoulder, I can lay on that lacrosse ball, either up against the wall or down on the ground, or even if I want more pressure, for example, like between my shoulder blades, I can lay down on the ground on top of the lacrosse ball with the 45-pound plate on my chest. So I can put a lot of pressure on there to really dig into those knots, and then start to break up that scar tissue. Quads, calves, even some stuff along the back, actually you can make a lot of change with just a straight PVC pipe. You can put a little bit of lotion on your quad, and instead of foam rolling on a spongy foam roller with just your body weight, which might be not enough or sometimes too much if you're sensitive, you can take that PVC pipe and just strip out your quads, almost like you're rolling dough, but you're not rolling, you're actually pulling and shearing apart the scar tissue, and that mimics what I would do with my forearm and elbow. So definitely invest in those two simple tools for that daily self-care, and start doing some basic movement assessments, some basic stretches. Just keep the body moving. Like mobility work is probably one of the least utilized part of the whole program. It's just, quite frankly, it's just boring. A lot of people would rather be, lifting heavy weights or running or being on their bike than spending that 20 minutes getting that stretching in. But for good self-care, that's an integral part of, taking care of yourself, is making sure you're flexible and mobile.
No, thank you. I appreciate that. So just to recap some of our conversation, obviously we learned about the benefits of sports massage in that it prevents injury. One key thing to remember when you're looking for a sports massage therapist is to go to someone that's specific for the sport that you do. So whether you're CrossFit, triathlete, golfer, basketball, baseball, whatever it is, go to someone that understands how your body moves in that sport and can help with preventing compensation patterns during that. If you do get an acute injury, so say you're a CrossFit athlete like many of our listeners, and you hurt your back in some way, going to see Don within 24 to 72 hours, that's where he's gonna be able to make the biggest difference in cutting down how long you're gonna be in pain. Make sure you do some self-care for at least 5 minutes a day, every day. And then ideally, if you, whether you are recovering from an injury or you're wanting to prevent one, seeing a therapist every 4 to 6 weeks is going to be kind of the sweet spot for making sure that you prevent injury down the road. So yeah, I think we threw a lot at you today. Don, thank you for being on the show.
Yeah, thanks for having me. It's great.
And everyone, thanks for listening, and we'll catch you on the next episode.